Dr. Joel Conn from Pismo Beach Veterinary Clinic joins us this morning. Last time we talked about keeping your pet's teeth clean at home, and today we're actually going to be learning more about dental disease and taking your pets into the vet and how they're treated there.
So as I talked about last time, February is National Pet Dental Month, so we can't get enough dental topics in this month. So last time, like you said, we were kind of talking about what you can do at home, and so today I thought we'd talk about where your vet takes over.
Okay.
So the big thing is bringing your pet in for dental cleanings, and you know the biggest concern that I see with owners is they're really worried about the anesthesia. Okay. And so I want to talk about why anesthesia doesn't have to be scary. And you know, in animals with dental disease, we know that untreated dental disease can predispose to heart disease, lung disease, liver disease, kidney disease, all sorts of major things, and actually has been shown to take sometimes years off a pet's life if left untreated. So while brushing and doing things at home is very helpful, just like you know, your pet is going to need to see your veterinarian occasionally. And it may be every year, maybe every couple of years. Some pets, you know, just like us, need to be seen every 6 months. And so what we do basically is, with the anesthesia, is we're creating a pain and a stress-free environment for the pet, and that's a really important thing. The American Veterinary Dental College actually recommends pretty strongly against anesthesia-free cleanings, which are something that we see more and more these days, where they actually do the scaling and such in an awake animal. And this is very stressful for your pet. And the other thing is you can't really clean appropriately below the gum line, because as you might imagine, I mean, we have a tough enough time sitting still ourselves. You know, even a well-behaved, you know, calm golden retriever is not going to tolerate you scaling below the gums, which is where most of that dental disease occurs. So with anesthesia, we can do that in a pain-free environment. And it allows us to very carefully chart the teeth. So we do the same thing your dentist does. We're looking for deep pockets. We're looking for mobility. We're looking for what's called furcation, where there's a tunnel between the roots. You know, and in some cases, if we can find that early, identify that early, those are teeth that we can save.
And I think we have some pictures of what you're talking about.
Yeah, so dental disease in general is divided into 4 stages is how we classify it. This would be considered stage 1. You can see there's some very early tartar on the gum line, a little bit of reddening of those gums, which is indicative of early gingivitis. As we go into stage 2, you're going to see an increase in the amount of tartar and staining on the tooth. See how red those gums are. Now they're taking on kind of a glossy appearance, kind of a puffy looking gum. If you push on that red area, it's going to blanch. You're going to see that there's quite a lot of irritation there. This is a gum that's going to bleed with even brushing. Stage 3, we start to get into deeper pocketing. You can almost see there between the roots, there's actually a little bit of a hole there. You could stick a probe probably clear through that tooth. Loss of bones, bone structure in this stage of the disease. And then stage 4, which is kind of end-stage periodontal disease, these are teeth that very often are not salvageable. Dramatic bone loss, dramatic furcation between the roots. You can see there's actually kind of some pus there on the gum line, sort of a nasty-looking tooth. And what we want to avoid is getting dogs in at stage 4. We want to see those dogs, just like with humans, that are in hopefully stage 1, maybe stage 2, get in there, clean the teeth, and save those teeth. And we can do that. And these are animals, you know, when they're in that stage, the anesthesia is going to be much safer because we don't have so much bacteria that's being dislodged into their system. And one of the things we do additionally is check pre-anesthetic blood work, make sure you have a good physical exam prior to the dental. We place IV catheters and have fluids running throughout the procedure. And we're using all the latest monitoring equipment, the same thing that your doctor might do during a surgery. So we're monitoring blood pressure, oxygen saturation, all that kind of stuff to make it very safe.
And now when we're talking about that safety, those types of things now making it more safe for dogs to go under. So I know, now is that because back they didn't use them before, and that's why kind of that mentality of it's not safe to put your dog under, is that why it's more safe now?
I think the mentality has shifted in a lot of ways. One of the things is that we're trying to get dogs in preventatively, whereas before it was always when they're 10 years old, all their teeth are falling out, and all we're doing is going in and extracting all the teeth, which is not our goal. So our shift now is preventative medicine, getting in there before the teeth are bad, so that's safer for the animal. And there's been just a lot of advances in veterinary medicine, just like in human medicine. So we're using the same anesthetic drugs if you, my brother's child recently went through a surgery. We use the same drugs that they used on her for her anesthesia. So we're using kind of the latest things.
That's very interesting.
And so, in general, very low risk. And we have to always balance the risk of the disease versus the risk of treating it. And we think in most of these cases, almost all cases, untreated dental disease is a huge risk to that pet's life.
Okay. Well, again, thank you so much for joining us this morning. I know
You're
it is
welcome.
very good information, especially about the anesthesia, because I know in the past I've been told that's, or by other people, not by a vet, that it's a little bit scary to have your, put your dog or cat, your pet under, and so I know I've thought to avoid it, but this is good information, and I'll definitely be bringing my dog in to get his teeth cleaned sooner than later.
Great information. My dog, we just gave him milk bones.
It's a good starting point.
Yeah. Well, if you do have a question about your pet's health, you could email it to askthevet@kcoy.com.